Now that your HAL Total Mobile Solution Simulator is ready for use, let us take a tour of his many features. Gaumard Scientific has recently introduced several new and advanced features to the HAL simulator. State-of-the-art total control blinking eyes with photosensitive pupils. The dilatation state of the pupils, the blinking rate, and light reactivity are easily manipulated from the tablet PC, giving the user total control. Our new Cyanosis feature allows the user to control the pallor of HAL's skin when hypoxic events occur. HAL features bilateral chest drain sites at the 5th intercostal space to simulate therapy for pneumo or hemothorax. Alternatively, one could utilize the needle decompression site to relieve a pneumothorax. To accompany the trauma leg, HAL now has an automated bleeding trauma arm. Attaching the trauma leg or arm is a breeze using Gaumard's Quick Connect trauma kit fittings. Both trauma arm and leg feature realistic arterial bleeding that is pulse and blood pressure dependent. Blood flow can be stemmed with the use of a tourniquet. HAL can be catheterized by exchangeable male and female genitalia. For additional realism, virtual vital signs monitors are available in both fixed and portable formats. Of course, HAL retains as many other features: a realistic airway, breathing, palpable pulses, and bilateral IV arms. HAL's airway can be intubated both nasally and orally using endotracheal tubes or an LMA. Intubation can be made more difficult by turning on pharyngeal swelling, laryngospasm, and tongue edema. Additionally, HAL can be ventilated with a BVM or a mechanical ventilator. Once intubated, sensors detect the depth of the intubating tube. Should the tube be inserted too deep, the left lung is automatically disabled, realistically demonstrating right mainstem intubation. Correcting the tube position re-enables the left lung. Ventilation and manual chest compressions are measured and logged, showing the instructor exactly how students are performing. Users can perform tracheostomy or needle cricothyrotomy. HAL has multiple upper airway sounds, which are synchronized with his breathing. Users can easily control rate and depth of respiration and choose independent left, right, upper and lower lung sounds, which are synchronized with selectable breathing patterns. Multiple sounds are available. HAL is equipped with several realistic heart sounds, which are tied to user-defined heart rate and selectable rhythms. HAL's conductive skin sites allow the attachment of real electrodes and defibrillator pads. This feature permits the user to track cardiac rhythms and events with their own equipment, just like with a real human patient. To add to this realism, HAL can be shocked with real energy for cardioversion and defibrillation drills. An AED will display HAL's ECG, analyzes cardiac rhythm, and advise action, a perfect addition to competency-based programs. HAL's conductive sites are conveniently placed anteriorly to allow easy access for pacing. HAL's palpable pulses are dependent on blood pressure. Users can also disable distal pulses to simulate severe hypotension. Programmable blood pressure can be read using a sphygmomanometer, and users can auscultate the Korotkov sounds. HAL has bilateral IV training arms that can be used for bolus or intravenous infusions, as well as for drawing fluids. In addition, he has IM sites on both his deltoids and quadriceps.